Joining us now, Republican Senator from Georgia and Vice President of the Select Committee on Intelligence, Senator Saxby Chambliss. Senator, good to have you on the show.
Hey, I heard y'all were having so much fun on Thursday mornings, and I just showed up. Y'all are letting me on. This is great.
This is awesome.
It's
so
nice to have
how's
you
your
on.
farewell tour going? Is it like Dr. J every town you go to, they give you like a basketball jersey?
I got so many plaques, Joe.
A lot of plaques.
Everybody likes you when you're leaving.
Yeah, you know, Koki, you'll appreciate this being, growing up around it. But we were on the bus in '95. We'd gone to the Pentagon and we were driving back to the Hill. And Saxby turned to me. This is 1995. He goes, it's a great thing. The generals saluting you and the admirals saluting you. And I know that's all exciting and everything. But sometimes I just sit and wonder whether this is all worth it or not. He said it's exciting the first or second time, and then you start going, well,
He said that to you 1 year in? 'Cause that was a year after you were elected.
Well, we all said that 1 year in.
Look at you, still here.
20 years later, whoever thought it.
And the plaques are worth it, is basically what you're telling us.
Oh, yeah, you
It's been fun.
Yeah, it's been a great run.
Should we start with Pajama Boy?
No.
All right.
No, not at all.
I want to know what Saxby thinks of that, but all right, we'll wait.
We're not going to do that.
Americans with, why not? Americans without health coverage
He's a
appears
distinguished senior statesman. It's
fine.
not 1995.
They appear to be more reluctant than the White House originally thought when it comes to embracing Obamacare. New York Times CBS News poll finds 53% of those without coverage disapprove of the health care law. That is slightly higher than the 51% who have insurance. The poll also finds that the uninsured have mixed feelings about the benefits of Obamacare. 33% say the law will help them. 37% say it will hurt them. But 56% of uninsured Americans say they are unlikely to get coverage before the March 31st deadline.
Let's go back to the first poll number that shows that the insured and the uninsured are about the same as far as
53,
opposing
51.
The president's health care plan. First of all, you said you had similar numbers in the NBC News Wall Street Journal poll.
Meaning that people without insurance didn't have a positive view of the healthcare law.
Why
that's what our poll, honestly, we're now thinking in our next poll we need to figure out, because that's what's missing here.
Yeah,
Why? What is it? Is it because there's all sorts of theories, and I don't want to, we can't sit here. Is it because they've had such a bad experience with the healthcare system before they don't believe this is going to work? Is it because they have their own financial issues? Is it because they've been scared? Nobody knows the why, and I think it is, basically we're all finding this. We had the same, we saw a similar thing. And in our next poll, we need to
because if you did a poll saying, do you believe Americans should have access to health care, probably a lot of people would say yes.
They might say yes, but the moral argument for this, though, from the left, when you say that you don't like Obamacare, the moral argument is, well, you must hate the uninsured. Why do you hate the uninsured? Why don't you want to take care of the uninsured? Well, this is a real political challenge for the White House, is it not? That the uninsured are saying, we don't like it either.
Well, and the uninsured could also be people that lost a job that had health care with it, maybe are working a job without health care and they're upset about that and they want to get a job. That's the point.
Totally
we don't know why. And I think
there's a lot of
Isn't the logical explanation the simplest one, which is that people don't want to have to be told to buy a product. It's simple.
That's right.
I mean, they would like to make their own choices.
In Saxby, there's also the cost concern. In the New York Times article, they talked about a lot of uninsured. The uninsured are worried about additional costs they don't want to have to pay.
Well, they were sold a product that they said they're not going to have to pay for. And that's just not true. They're now finding out that everybody's going to have to pay something at some point in entering the system. Some of it's going to be up front. Some of it'll be when you go to the doc or to the hospital. And this is money that some folks just don't have.
Well,
it seems like
the reason some people are uninsured in the first place, many of them, is because they haven't wanted to pay for health care. And they've decided it was not important, and this is mainly young people, but it is others as well. And so you tell somebody that actually you are going to have to pay for health care, you can see where there might be a resistance to that. And there will be subsidies that they're not aware of.
Exactly.
But this really, though, does, Saxby, lie at the heart of the dispute between conservatives and liberals or progressives, whatever they want to call themselves these days, and that is that liberals are more paternalistic. They want to tell you what is best for you, while conservatives believe you should be able to make the decision yourself. And right now, at least, the poll numbers are suggesting that there are a lot of uninsured Americans that are saying thanks, but no thanks. It's the old Ronald Reagan line, the most dangerous 7 words in the English language are, I'm from the government and I'm here to help.
Yeah, and the government, people are finding out, is not the best resource. More and more people who thought that was right are finding out it's not right. I think an interesting number that I have seen, and it's not reflected in your polls, but Chuck, you may be more familiar with this, and that is that we kept hearing the word or the number 30 million, 40 million people are uninsured as we were debating Obamacare. Mm-hmm. And now what we're hearing is that at the end of the day, when all is said and done, there's still going to be about 30 million people who are uninsured. Now, how that translates out, I'm not sure, but what it does say is that that crowd of young folks that Koki was talking about are not excited about this. They are not jumping on board and not willing to shell out $300, $400, $500 a month that they hadn't been used to paying.
Well, the White House knows they have a problem with this young issue. That's what this event was yesterday, this whole moms thing. Mm-hmm. They did a bunch of focus groups on this, and the most reluctant are basically single men under 40. They're the most reluctant. They're the most sitting there going, why do I need to shell this out?
Look, they all think they're immortal.
Well, but we aren't. The state of Virginia.
Guys don't figure out they're going to die until they
right.
And they go, oh my God, we're going to die.
But the state of Virginia.
And actually, even then.
When I first, I had various apartments, and I remember having an apartment in the state of Virginia, in Arlington, and the state of Virginia allows you to basically pay a fee not to have auto insurance. You can pay a fee not to have auto insurance. Sort of same idea here. Yeah. You pay a penalty, and let's just say I had reasons why my auto insurance was a little bit high.
Yeah.
And it was cheaper not to pay.
Right.
And, I remember I forked out the money. It was easier. I was thinking, what, I just, so what if I crash my Golf? And I think that's been the issue that they know they are dealing with.
Of course, it doesn't work for the person that you crashed
into. The answer to your uninsured question, Senator, is that there are actually going to be 51 billion uninsured by the end of this implementation. They're going to end up with 30 uninsured. Part of it is because states run by Republican governors have not expanded Medicaid. So that is creating a pool of uninsured eventually. But the actual number of uninsured, the universe is much larger than 30 to 40 million. It's going to be 51 million.
All right. So, by the way, that Reagan quote's 9 words, not 7.
9. Good.
Supercomputer in my head went off.
Senator, I want to push back a little bit on your comment about the costs or the unexpected costs to people, because first of all, it's about affordable health care. It's not about free health care. And I would think that both parties would agree that at some point in this country, nothing comes for free. But do we want to continue to doing it the way we're doing it, where everyone goes to the emergency room and all of us pay astronomical costs in one way, shape, or form, and our country goes downhill because we haven't tried to solve this problem and try and get people covered by insurance and get other people who can't afford it in some way to get in and get young people covered on their parents' plans? I mean, there are some good aspects to the point of this, are there not?
To say that everything, every provision in Obamacare is a bad provision is not right, and we've never said that. There are some good provisions. Everybody wants to see pre-existing conditions covered. Everybody wants to see the pool of insured spread across a large number of folks, because that is the way you drive health care costs down, and you do that by making it affordable. We want to allow the purchase of insurance contracts across state lines. All of those things, I think, are good provisions. The problem is that when you tell young folks you're going to have to do this, and this is affordable, and all of a sudden they're paying $400 or $500 a month that they've never paid. To them, that is not affordable. So,
Senator, let me ask you about, there's a unique issue that I know Georgia's having more of a problem with than some other states, and this issue of the rural hospitals, right? Rural hospital, because Georgia is a state that decided not to take the Medicaid money, and the rural hospitals are feeling caught. Some of them are running out of money. Some of them might have to close down. And I know there's basically the state governments are saying, well, this is because the federal government's holding the state hostage with this Medicaid money, and suddenly I guess there used to be some Medicaid money available to these hospitals that won't be unless the state takes the Medicaid money. And I know, I know there's some dispute, but in the larger question, considering where we are with the law now, do you think you think the governor should accept the Medicaid money?
No, I don't, and here's the reason why. In our state, and you're right, we've got probably more rural hospitals than maybe any other state just because of the size of our state physically. My daughter's a pretty good example of what's happening to healthy folks today. She called me this week, just raising Cain with me, said, next time you see the president, you tell him this. Her premium, her premium for a family of 5 that are basically healthy is going from $500 a month to $1,500 a month. And at the same time, if we expanded Medicaid in our state, we would get a check from the federal government for the first 2 years, first 3 years, whatever it is, and then basically we're on our own. And we're going to have to raise taxes in Georgia to cover that $5 million, I think, is the estimate.
What is it, 90%? It's going to be covered 90% after 3 years,
Right.
and then that's the gap you guys have to cover.
Right.
Yeah,
10%.
and we don't have that money now, and so we're going to have to raise taxes. So here's my daughter and her family, who were taxpayers, number one, and they're seeing their premium go up by this amount. Then they're going to see their state taxes go up by an additional amount to cover that.
And Chuck, that is an argument that you hear, is it not, from governors, Democratic and Republican governors over the past decade, that their biggest fiscal challenge is Medicaid.
Yeah.
But health care is the biggest fiscal challenge, period.
Right.
That's
In the
where
States,
we
it's
are.
Medicaid, and in the federal government's Medicare.
Medicare.
Yeah.
Yeah.
And you know, and GM spends more on health care
Was
than
that
on
great line?
steel.
GM is a
You know,
healthcare, right?
and
GM is a healthcare company that makes cars.
Also makes cars.
that
And
was always
one
of the-
explanation for that poll might be Pajama Boy.
Yeah, I think so.
You think it's Pajama
I think
Boy?
it's Pajama
All right.
Boy.
What are they
Lay off
thinking,
Pajama Boy,
man?
poor
What are
guy.
they thinking?
That is not
Chuck
going to work.
Todd, is that how you look over Christmas vacation?
I think it's
Because
Sam Stein.
nobody in my house looks that way.
I have the pajamas, I just don't look, I don't have the glasses.
Okay, please.
If a picture paints 1,000 words
One more
of
story
what,
to get to
what
here.
Obamacare
Okay.
liberals look like right there, Chuck. What do you think?
It's not a good picture for the progressive movement, is it? Right?
Really not.
You know.
Okay.
Oh, those
All
are
right.
the pictures that Saxby and I. They just make Saxby and I get in the holiday spirit.
I was wondering what happened to Screech from Saved by the Bell.
Oh, there you go.
Seeing you in pajamas is something I don't want to
No,
picture.
exactly.
on Christmas
Don't
morning.
Then Saxby, don't watch TV on the 23rd. It's gonna be in
His
our
have
PJs.
footies though. He's got the little.
He's
Going to have
Yeah.
footies
Gonna have
on.
big footies.
A task
The
force
flap.
appointed by President Obama is now recommending big changes to how the NSA does business. Among the recommendations, the government would have to request access for data stored by phone and internet companies. There would be no more blanket court orders for personal information. Another recommendation aims to put the NSA under civilian control, something the White House has already rejected. The task force also found that bulk collection of telephone records is not essential to preventing terror attacks. Senator Rand Paul is calling on the Director of National Intelligence to resign over testimony he gave before the Senate.
That Clapper's lying to Congress is probably more injurious to our intelligence capabilities than anything Snowden did, because Clapper has damaged the credibility of the entire intelligence apparatus, and I'm not sure what to believe anymore when they come to Congress. And I do think what our government is doing is unconstitutional, and I really think that in order to restore confidence in our intelligence community, I think James Clapper should resign.
So, Saxby, what's your take on Rand Paul's suggestion that James Clapper should resign?
Well, I don't think he should. I mean, I've known Jim Clapper for years and years. He's a man of integrity, and he's done a good job at
Rand Paul
DNI.
says he misled the Senate
Well,
and the nation.
here's
in his
my problem
testimony.
with what happened in that scenario. Senator Wyden asked a question in an open hearing that he knew if Clapper answered it correctly, he was going to have to divulge classified information.
In a public hearing.
In a public hearing. And what, frankly, DNI Clapper should have said is, look, you and I can have a private conversation. I'm happy to answer that. He didn't. He wasn't thinking quick enough, and he didn't answer it correctly, but Senator Wyden knew the
I was going to say,
answer
it
to the
sounds like
question.
you blame the senator who asked the question. He knew the answer. answer to.
Well, what Senator
much as
Wyden will
Clapper.
tell you is, and I'm sure this is correct, is that he sends his questions to the witness the day before. So he will say, he knew I was going to ask
So
this
Clapper
question.
knew ahead of time.
But in any event, he couldn't divulge that.
So what do you think of the new guidelines?
I'm sorry?
What do you think of the new guideline suggestions? Will it make America less safe?
You talking about the recommendations
The
of this commission?
recommendations, yeah.
It's going to be interesting to see how many of the 46, I think it is, the president adopts. He's already rejected the putting the NSA under a civilian head, and I think that's the right thing to do.
Why? How was that
why?
an automatic reject? That was the one that seemed to be. I mean, it's not really under right now much of an oversight, and it's technically confirmed by the Senate, but not. And there's just because undersecretaries of defense are. Why shouldn't we get this out of military control?
Because you move it into the political arena, Chuck, when you do that. And this agency is too sensitive. It does things that, the military does better than the private sector. This is one of those situations. And plus, there's so many folks involved in the military that are on both sides, both the intel gathering side as well as the customer side. The largest customer, the NSA, is the United States military. And that relationship that exists between the leader at the NSA and the military needs to be a very, very close bond.
Senator,
now, I do think that the
You make
director
that case,
of
though,
NSA
why
ought to be confirmed.
We can make
by
that
the
case
Senate.
that Secretary of Defense should be a military person. We made that decision that no, there should be a civilian head of the Pentagon. This is all that these folks are.
And Senator, I have a quick question. One of the things that strikes me about this review and a lot of other criticism of this program is that essentially it doesn't give us much. I mean, the review said that it hasn't helped us uncover that many plots over the course of its usage. And if that's the case, then what is the case for actually maintaining such bulk data?
Yeah, well, how many cases does it take?
Right.
I mean, we've made public the fact that there are 54 instances that we've interrupted and disrupted from a potential attack standpoint. Does the death of another 2,000 Americans have to happen before we step in and say, well, hey, that probably is a good program? I don't think
Senator, we were just having a little conversation off the air, but this all comes in the context of the heads of the two intelligence committees that, excuse me, in the House and Senate saying we're in a very dangerous situation right now, that the likelihood of a terrorist attack is greater than it has been in recent years.
Yeah.
Why is that?
Well, there's a lot going on out there, number one, from the standpoint of pre-9/11. The focus was on training terrorists in Afghanistan. We knew that was happening, and we were doing our best to monitor it, but we didn't have the capabilities back then that we have now with NSA, by the way, these programs. And now, what do you have, Koki? You got terrorists training in Syria. You got terrorists continuing to train in Afghanistan. You got Pakistan. You've got them spread all around the world. You've got homegrown terrorists. We've seen a number of Americans who have joined the fight, both overseas as well as on domestic soil, such as the Denver plot to blow up subway systems in New York. So there's a lot more of them out there, and they're spread out in areas that it makes it more difficult for us to cover the whole spectrum.
Senator Saxby Chambliss, great to have you on the show.
Saxby.
Thank you so
Always
much.
a pleasure.
Chuck,
Great
stay
to
with
have
us.
you.
Can't wait to see you in pajamas.
It's going to be
It's a
great.
sight.
Keep bringing up that visual.
Will you
We're
wear-
going to flip away.
I think I'll skip it.
Yeah.
Will you wear the pajama boy?
That's during the 8
Maybe so.
a.m. hour.
Okay.
Only with the Yule log, though.
Well,
Don't get the Yule
We
log.
got it. We're going to do it. We do it every year.
Yeah.
All right, up next.